Are you an older adult who sometimes feels a little slower, perhaps struggles with memory, or notices your energy isn't quite what it used to be? Maybe you're also facing frustrating challenges like numbness in your hands or feet, cuts that take forever to heal, or even difficulties with intimacy, such as weak erections. If you've nodded along to any of these, especially if you also manage diabetes, then listen closely. These aren't just minor annoyances. They are critical signals from your body, often pointing to a silent, widespread problem: poor circulation and blocked veins. What if you could turn the tide on these issues, not with risky procedures, but with simple, natural strategies? You can start today. This isn't about temporary fixes or quick gimmicks. It's about understanding what's truly going on with your blood flow, your nerve health, and how your blood sugar plays a major role, especially in those sensitive areas where it counts most. Missing this could mean missing out on a healthier, more vibrant life, but staying with us right now means you're about to discover how to support your body's incredible ability to repair itself and restore vital flow. Keep watching because we're revealing 3 powerful vitamins that can help revitalize your circulation, followed by a surprising benefit of dark chocolate, and how your everyday choices can actually talk to your genes to heal past damage. Let's dive in. Let's begin with vitamin number 1, methylcobalamin, which is a key player in helping your body mend nerve damage, a common issue for those with diabetes. This is especially true for the tiny nerves that control how blood vessels expand and contract, including those important vessels in the penis. When these nerves are damaged, arteries and veins can't properly relax or tighten, leading to sluggish blood flow and difficulties with erections. Methylcobalamin actually assists in rebuilding the protective shield around your nerves, called the myelin sheath, which helps nerve signals travel faster and restores better muscle control in those critical blood vessels. This repair is vital because without proper nerve communication, blood vessels might not open completely, causing blood to pool and leading to blockages. Many people who've consistently taken this supplement have reported feeling better, nerve sensitivity, and experiencing stronger erections because their blood vessels are responding more effectively. What makes methylcobalamin truly unique, beyond being a general helper, is its ability to lower levels of homocysteine. This is a harmful amino acid that can make your arteries stiff and contribute to the formation of plaque, even in the delicate arteries supplying the penis. By reducing homocysteine, methylcobalamin helps protect the inner lining of your arteries, preventing damage and supporting the production of nitric oxide, which is essential for blood vessels to widen. This double action helps stop further narrowing and begins the repair process for clogged vessels by making them more elastic and reducing early blockages. Studies have shown a significant drop in homocysteine within weeks of taking methylcobalamin, which is often linked to improved blood flow throughout the body. Beyond its nerve-healing powers, methylcobalamin is crucial for forming red blood cells, which carry oxygen. In diabetic tissue, especially in the penis, there's often a shortage of oxygen called hypoxia. This lack of oxygen weakens blood vessel walls and slows down repair, making existing blockages worse. By boosting healthy red blood cell production, methylcobalamin ensures that your body gets all the oxygen it needs. This not only speeds up how cells work, but also helps flush out waste from clogged veins. Better oxygenation also improves the tiny powerhouses within your cells, giving them the energy needed to keep blood vessels open and clear. Tissues that receive plenty of oxygen are also less likely to develop scar tissue, a common problem in diabetes that can further tighten blood vessels. For those dealing with insulin resistance, constant inflammation harms blood vessels and causes fat to build up, leading to plaques that restrict blood flow to the penis. Methylcobalamin can help here too by making your cells more sensitive to insulin. This improves how your cells use energy, reduces stress within them, and lowers inflammatory chemicals. This overall improvement not only helps prevent new blockages, but also assists in breaking down existing plaques. Better insulin function indirectly helps unclog veins by keeping blood sugar levels steady, which in turn reduces harmful stress and inflammation around the blood vessels in the penis. Research suggests that with methylcobalamin use, improved insulin sensitivity can lead to noticeable reductions in signs of blood vessel inflammation, paving the way for better blood flow. Maintaining a healthy balance of cholesterol is absolutely vital for your blood vessels, especially if you have diabetes, where harmful LDL cholesterol tends to build up in artery walls and cause plaque. Methylcobalamin indirectly supports cholesterol health by improving liver function and lowering overall body inflammation. This helps keep your beneficial HDL cholesterol levels healthy, which are responsible for removing excess cholesterol from your blood vessels. This action prevents further buildup in the arteries and veins of the penis, reducing blockages that can hinder erectile function. Studies have even linked methylcobalamin to a decrease in the oxidation of LDL cholesterol, which is a critical step in the development of hardened arteries, emphasizing its role in keeping the blood vessels in your penis clear and flexible for healthy blood flow. Intimate health and vitality depend on a delicate balance of hormones, nerve signals, and healthy blood vessels. Methylcobalamin helps increase dopamine, a brain chemical that boosts desire, and also shields sperm DNA from damage caused by poor circulation and high blood sugar. When blood vessels in the penis are clogged, oxygen and nutrients can't reach reproductive tissues effectively, which can lower sperm quality and reduce desire. By restoring blood vessel health through its anti-inflammatory and nerve-supporting actions, methylcobalamin indirectly supports a healthy hormone balance and sperm production. Clinical evidence even links improved blood vessel function from methylcobalamin supplementation with increased sperm movement and count in diabetic men over several months. Finally, the ability to achieve and maintain an erection relies heavily on fast, coordinated nerve signals and sufficient blood flow. Methylcobalamin improves how quickly nerves transmit signals by repairing their damaged protective coverings. This leads to quicker muscle responses in the penile blood vessels. At the same time, better blood flow through unclogged veins helps maintain pressure in the erectile tissue for longer periods. This combination results in more natural erection timing and can help reduce premature ejaculation caused by nerve and blood vessel issues. Reports from patients and medical studies show improved nerve function after methylcobalamin treatment, which matches up with better erectile response times. While you can find methylcobalamin naturally in animal foods like red meat, liver, fish, eggs, and dairy, diabetics, especially those taking metformin, often struggle to absorb enough, making supplements necessary for its benefits. Supplements are typically available as easy-to-take under-the-tongue tablets or injections, which bypass digestion problems and ensure your body uses it effectively. For significant improvements in unclogging blood vessels in the penis and restoring erectile function, a daily dose of 1,000 to 5,000 micrograms, depending on the severity, is recommended for at least 3 to 6 months. Long-term supplementation, alongside careful blood sugar control and healthy lifestyle changes, offers the best chance to reverse the impact of diabetes on your intimate health. Moving on to vitamin number 2, vitamin D. A lack of vitamin D directly affects how well your body handles insulin. When vitamin D levels are low, muscle and fat cells don't respond as effectively to insulin, which leads to higher blood sugar. High blood sugar, in turn, damages the tiny, delicate blood vessels in the penis, causing them to narrow and restricting blood flow. Having enough vitamin D helps restore these important signaling pathways, improving blood sugar management and easing the stress on blood vessels that contributes to blockages. Beyond blood vessels, your kidneys are vital organs for your overall health. Sometimes called the quiet victims, they can show issues that impact how your blood vessels expand and contract. Too much calcium in certain cells can cause excessive contraction and stiffness, increasing tension in blood vessels and leading to poor blood flow in the penis. Vitamin D helps control these calcium channels and promotes the relaxation of these muscles, allowing veins to stay flexible and resist narrowing. This is incredibly important for diabetics, where high blood vessel tension adds to the risk of erectile dysfunction by preventing veins from expanding and draining blood efficiently. Vitamin D also plays a crucial role in managing cholesterol by regulating how the liver creates bile acids. This process helps reduce the amount of cholesterol circulating in your blood and prevents it from settling in the walls of the arteries in your penis. Furthermore, vitamin D boosts the genes responsible for moving excess cholesterol out of cells. By maintaining this balance, vitamin D lowers the risk of plaque formation that leads to clogged blood vessels, thus supporting the healthy blood flow necessary for erections. High creatinine levels, often a sign of kidney strain or dysfunction in diabetes, indicate poor removal of waste and excess fluids. This increases blood volume and pressure within your vessels. Vitamin D supports kidney health by regulating parathyroid hormone activity, which influences fluid balance and electrolyte levels. Improved kidney function, bolstered by enough vitamin D, helps reduce the burden on your blood vessels and prevents increased tension in the penile veins, helping them stay clear and unclogged, essential for erectile performance. Cellular aging speeds up due to constant inflammation and oxidative damage in diabetes, which breaks down the collagen and elastin fibers that keep blood vessels flexible. Vitamin D activates several anti-inflammatory pathways and increases the production of protective molecules like glutathione, reducing oxidative stress in the cells lining your penile blood vessels. This protective environment slows down hardening and calcification in the veins, preserving their structure and function. By maintaining youthful vascular tissue, vitamin D prevents stiffness and blockages in penile veins, improving overall erectile capacity. Vitamin D's hormone-regulating properties also extend to the system that controls testosterone production. Low vitamin D levels are linked to lower testosterone, which contributes to decreased desire and fertility issues. By getting vitamin D levels back to normal, testosterone production improves, boosting sexual desire and sperm quality. The improved blood flow in the penis from healthier veins works together with balanced hormones, leading to better intimate health outcomes and sustained desire in diabetic men. Vitamin D also affects the connections between nerves and muscles that control erections by promoting the creation of important signaling chemicals like acetylcholine, which are vital for muscle relaxation in the penile blood vessels. This biochemical support improves the timing and strength of erections, ensuring that penile veins widen and contract correctly during arousal. Better nerve muscle coordination reduces the risk of delayed or insufficient erections, which are common with diabetic blood vessel and nerve complications. While you can get vitamin D naturally from sunlight and foods like cod liver oil and fortified cereals, many diabetics have limited sun exposure or issues with skin synthesis, making supplementation important. Vitamin D3 supplements are preferred because they're absorbed better, stay in the body longer, and are more effective at raising and maintaining the active vitamin D levels needed for healthy blood vessels and reproductive function. Adequate vitamin D helps regulate blood vessel tone and reduces inflammation, which prevents the stiffening and clogging of penile veins often seen in diabetes. Typical daily doses range from 2,000 to 5,000 IU, and consistent use over 3 to 6 months is usually needed to see improvements in penile vein health, insulin sensitivity, and erectile function. Maintaining these optimal levels long-term supports ongoing blood vessel repair, improves how the inner lining of vessels functions, and helps prevent future blood vessel problems related to diabetes. What if a simple antioxidant could protect your arteries from diabetic damage? Let's discuss vitamin number 3, vitamin E. This powerful vitamin, especially in its gamma tocopherol form, acts as a strong antioxidant, guarding your blood vessels against damage from unstable molecules called free radicals, which are particularly abundant in diabetic conditions. This kind of stress accelerates the formation of plaques in penile arteries, contributing to hardening of the arteries and vessel blockages. By neutralizing these harmful molecules, vitamin E slows down the progression of arterial stiffening and preserves the health of penile veins, ensuring smoother blood flow, which is crucial for maintaining erections. The benefits of vitamin E also include boosting the production of nitric oxide in the cells lining your blood vessels. Nitric oxide is a key molecule that signals blood vessels to relax and widen, allowing arteries and veins in the penis to expand properly during arousal. Better function of these lining cells directly leads to improved blood flow and reduced resistance in the vessels, which prevents blood from pooling and causing congestion in penile veins that leads to erectile difficulties. Unlike some other antioxidants, vitamin E specifically enhances this widening pathway, making it particularly important for blood vessel health in diabetics. Vitamin E also helps keep your red blood cells stable, protecting them from damage and making them last longer. This ensures that oxygen is efficiently delivered to the tissues in your penis, which is vital because a lack of oxygen promotes inflammation and scar tissue in blood vessel walls. By maintaining a healthier population of red blood cells, vitamin E indirectly slows down cellular aging and stress in the penile blood vessels, which otherwise contributes to vein stiffness and impaired blood flow. In terms of managing cholesterol, vitamin E prevents the oxidation of harmful LDL cholesterol particles. Oxidized LDL is a major player in the start and progression of plaque formation within arteries. By blocking this damaging modification, vitamin E reduces fat buildup in penile arteries and veins, lowering the risk of blockages that interfere with normal erectile function. This antioxidant property helps maintain flexible and unclogged blood vessels, which are necessary for sustaining an erection. Vitamin E's anti-inflammatory effects also work to reduce blood vessel inflammation, often linked with high blood sugar levels. Constant inflammation thickens arterial walls and reduces their flexibility, impeding blood flow to the penis. By moderating inflammatory chemicals and decreasing the activation of cells lining the blood vessels, vitamin E promotes a healthier blood vessel environment where veins can function without excessive constriction or blockage, which improves erection quality and duration. The vitamin also plays a role in supporting your immune system, which is important for preventing tiny blood vessel complications in diabetes. A well-regulated immune response avoids excessive damage to blood vessels caused by immune cell attacks and oxidative stress. This protection preserves the microcirculation in penile tissues, supporting both intimate health and desire by ensuring consistent nutrient and hormone delivery necessary for proper function. Vitamin E influences hormonal balance by protecting the cells in the testes that produce testosterone. Oxidative stress can damage these cells, leading to reduced testosterone production, which negatively impacts desire and fertility. By lessening oxidative damage, vitamin E helps maintain testosterone levels, which, combined with improved penile blood vessel health, contributes to a more vibrant, intimate life. Regarding the timing and quality of erections, vitamin E contributes to better muscle relaxation and nerve signaling in the penile blood vessels by shielding the fatty membranes of nerve cells from oxidative injury. This leads to faster nerve impulse transmission and more coordinated blood vessel responses during arousal, supporting stronger and longer-lasting erections without premature loss of rigidity. You can find vitamin E naturally in foods like almonds and hazelnuts, seeds such as sunflower and pumpkin seeds, green leafy vegetables like spinach, and oils like sunflower and safflower oil. However, For diabetics facing higher levels of oxidative stress, mixed tocopherol supplements, especially those rich in gamma tocopherol, may be necessary to reach effective doses. These mixed supplements are preferred because they offer a broader range of vitamin E forms, including alpha, gamma, and delta tocopherols, which work together to provide more comprehensive antioxidant protection. Gamma tocopherol, in particular, is more effective at neutralizing certain harmful reactive nitrogen species that contribute to inflammation and blood vessel damage in diabetes. Daily intake of 200 to 400 IU over a period of 3 to 6 months has been shown to improve blood vessel function and reduce oxidative damage in diabetic blood vessels, gradually helping to unclog penile veins and enhance erectile function. Consistent supplementation alongside managing blood sugar and maintaining a healthy lifestyle is key for long-term benefits. Now, let's explore how compounds found in dark chocolate can help reduce congestion in penile veins. Dark chocolate, especially varieties with a high cocoa content of 70% or more, contains powerful compounds called flavanols that have a significant impact on blood vessel health, which is incredibly beneficial for diabetics struggling with clogged veins. Flavanols help stimulate the production of nitric oxide in the cells lining your blood vessels. Nitric oxide is a vital molecule that signals blood vessels to relax and widen, improving blood flow. In diabetes, problems with these lining cells often reduce the availability of nitric oxide, leading to stiff, narrow arteries and veins that restrict blood flow. By boosting nitric oxide, the flavanols in dark chocolate help restore proper blood vessel widening, reducing resistance within the penile veins and arteries. This supports better erectile function and can even reverse some of the damage caused by chronically high blood sugar. Enjoying about 20 to 30 grams of high cocoa, 70% or higher, dark chocolate daily has been shown to provide meaningful blood vessel benefits without adding excessive calories or sugar. Clinical studies suggest that consistent intake over a period of 6 to 12 weeks can lead to measurable improvements in the function of the blood vessel lining and arterial flexibility, which are essential for unclogging penile veins and improving blood flow. It's important to choose dark chocolate that is low in added sugars and fats to avoid any negative impact on blood sugar control, especially for those with diabetes. Combining this dietary approach with proper blood sugar management and a healthy lifestyle significantly amplifies these benefits. Finally, we'll uncover how your lifestyle choices can actually alter your genes and how vitamins can help fix that damage. Diabetes and poor lifestyle habits, like an unhealthy diet, smoking, and ongoing stress, can trigger what are called epigenetic modifications. These are chemical changes to your DNA that alter how genes work without actually changing your genetic code. These changes can effectively switch off genes that are responsible for maintaining healthy blood vessels, or they can switch on genes that promote inflammation and the formation of scar tissue in arteries and veins. Over time, this disruption leads to stiffening, narrowing, and clogging of blood vessels, including those in the penis, contributing to erectile dysfunction and reduced blood flow. These epigenetic changes also impair your body's natural repair mechanisms for blood vessel cells, making it difficult for damaged veins to recover and reopen naturally. This creates a challenging cycle where ongoing gene dysfunction worsens blood vessel health and complicates diabetic issues. Thankfully, vitamins play a crucial role in influencing these epigenetic mechanisms. They provide the necessary components for enzymes that add or remove chemical tags on your DNA and the proteins around which DNA is wrapped. For example, vitamins involved in methylation processes, such as B12 and folate, help restore normal gene expression by correcting harmful methylation patterns that can silence protective genes. Additionally, antioxidant vitamins reduce oxidative stress, which is a major driver of these adverse epigenetic changes. thereby preventing further gene damage. Through these actions, vitamins support the reactivation of genes that promote blood vessel flexibility, reduce inflammation, and enhance the repair of the vessel lining. This epigenetic modulation helps diabetic patients gradually reverse blood vessel dysfunction, unclog penile veins, and improve overall blood flow, even when genetic predispositions or past damage exist. Thanks for watching. Have you tried any vitamins or natural remedies to support your blood vessel health or intimate wellness? Drop your experiences in the comments below. I'd love to hear from you. If you found this helpful, please like the video and subscribe for more tips on managing diabetes and improving your health. Also, check out our other videos for more helpful advice. Stay healthy, and we'll see you next time.